Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, March 24th. Before we begin today, I would like to advise our viewers and listeners that during the next several weeks of the election period, the format of these updates will be different. Dr. Hanley will be our only speaker, and in addition to providing any case updates, we'll focus on the technical aspects of COVID. We will announce a week ahead what the topics for the next update will be, and will solicit questions from the public for these sessions related to those specific topics. Questions can be sent to HSS Facebook or hss@yukon.ca. Sign language interpretation will be provided by Mary Thiessen, and French language translation will be provided by André Boursier. The Q&A format will remain the same. We will call reporters by name, and each will have 2 questions. Before we begin with our speaker, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Dr. Hanley?
Thank you, Pat. Good morning, bon matin. As Pat indicated, these updates will look a little different in the coming weeks now that we are in this election period. I'll still be providing regular updates, but we'll focus more on some of the clinical and technical aspects of the COVID situation for the next few weeks. Our month of anniversaries continues. Monday, March 22nd marked the anniversary of our first confirmed cases of COVID-19 in Yukon. It's hard to believe that was 12 long months ago. Since then, we have all endured hardships, for some more than others. But overall, we have managed to maintain low case counts and the relatively light restrictions compared to most of the rest of the country. At present, we continue with no active cases of COVID-19 to report. Recent concerns about cases at the Kerr mining Silvertip mine in northern BC are also now settling. As of today, there are no new cases at the mine, and the outbreak appears to be under control. This mine matters to us particularly because there are many Yukoners who work at the Silvertip mine, moving back and forth between the mine site and their Yukon-based homes. Once the mine announced COVID cases on site, our risk here for transmission to Yukoners went up. When we were advised of the outbreak, we issued a notification to all Yukoners employed at the mine and reached out to all the workers from the territory who had been on the job site as a precautionary measure. We advised anyone who had been working at the mine and had left within the previous 2 weeks to self-isolate and monitor for any COVID-19 symptoms. Since the situation is now stable, those who have been requested to self-isolate have since been instructed to resume their regular activities. People have asked why, when there were no Yukon cases, we would issue this notification. Sorry, we took this approach for the same reason that we have acted with caution in many other circumstances, to prevent possible spread of COVID infection to people in Yukon. In addition to the Yukoners who work at the mine, there are also suppliers who move back and forth between Yukon and the mine site. People who are not necessarily workers at the mine, but who may come into contact with workers while on site. And although we were provided with a list of workers who work at the mine, we also wanted to ensure that anyone who might have been left off that list also got the information. Lastly, it was important for us to let the public know of the risk, our concerns, and the actions we were taking. Being asked to self-isolate on short notice is disruptive and never easy. We did therefore take the additional step of offering self-isolation assistance for some individuals who did not want to return home until they were sure they had not contracted the virus. We also mobilized a vaccine team to Watson Lake to offer vaccinations to any of the workers who had not yet been vaccinated. All of these actions were taken in a spirit of a precautionary approach. We know that the greatest risk of COVID in Yukon right now is through importation, and those cases at the mine could have meant new cases for Yukon. I've received many questions about variants and why they are so important to consider in any recommendations we make to the government around lifting of public health measures. I'd like to try and address some of these questions. By just looking at the patterns of variant spread that we are seeing, not just around the country, but in the US and Europe and elsewhere, we have to remain concerned about the risk of importation of variants into Yukon. The growing presence of variants has definitely increased our susceptibility to importation of a rapidly spreading COVID infection that still could lead to significant transmission even as our vaccination rate climbs. The behavior of variants and how effective the vaccine is against variants are two key factors that will be included when we look at what changes we can make to restrictions here in Yukon. First, though, to review, what is a variant? Variants are simply viruses that have mutated. Viruses, basically clumps of protein that are able to reproduce themselves, are continually changing or mutating by random switches in the amino acid patterns that make up the proteins. And sometimes some of those random mutations give the new strains an advantage over the old ones. 3 variants of concern, ones that we're more worried about, have been identified already in Canada. The B117, or UK variant, the South African variant, or the B1351, and the P1, the Brazilian variant. A common feature of these variants is that people can pass them along to each other much more easily, so case rates can rise much more quickly as a result. Increased transmission means rapid, even explosive growth within a setting where people share a space, especially where people are close together, such as in a household or a workplace that may not have good physical distancing in place. Even though new and still not totally familiar, we are learning quickly about these variants. Here are a few things that we have concluded so far. B117 is easily transmitted, about 1.5 times as easily as the regular COVID strain. In fact, all 3 of these variants of concern are more transmissible than traditional COVID. That is why they're successful variants. The B117 strain has been identified in all provinces in Canada and is likely to become the dominant strain in many areas within a matter of weeks. It is hard to determine whether B117 causes more severe disease, but we think this may be so. More important, though, is that as higher numbers of people become infected, more people, even younger people, will get seriously ill, and that is what is being reported in other parts of the country, such as southern Saskatchewan at the moment. B1315 and P1 are just as easily transmitted, and P1 appears easily capable, as in Manaus, Brazil, of causing repeat infection after regular COVID. The P1 variant is very concerning because of this ability, and we need to watch this one closely. There's also concern about this variant being possibly resistant to the current vaccines. Earlier modeling of COVID spread with variants is now proving true as we watch COVID cases once more increasing in Canada. The modeling suggested that if variants are not successfully managed, there is the possibility of an unprecedented increase in case counts in Canada prior to the ability to vaccinate enough people. So what's the good news? Well, every day we're learning more about the variants, and that helps us plan and adapt our public health response and measures to combat the virus. The Moderna and Pfizer and AstraZeneca's vaccines have been shown to protect against B117, and vaccine is the best tool we have to fend off this variant. And public health measures work well against these variants. Outbreaks such as the recent one in Newfoundland have been successfully controlled with the lockdown measures that we now know so well. Newfoundland showed us that the B117 strain is controllable if public health measures are applied in combination with testing and thorough contact tracing. As always, these 3 key tools, public health measures, testing, contact tracing, work best together as a trio. Our best defense against the introduction of these variants, particularly the fast-spreading B.1.1.7, remains getting as many people vaccinated as possible while faithfully continuing to follow public health measures. Together with the continuation of public health measures at a high level of adherence, we will be able to fend off the variants. As we do this, we are cheering for the rest of Canada to do the same, and at the same time, our international neighbours, and then the rest of the world as soon as possible. Even a place as far away as Brazil, with rampant spread of variant COVID, poses a risk for us of new variants, of international spread of potentially challenging and vaccine-resistant variants, and of the potential for havoc here. As we move forward, we have to keep in mind that decisions about relaxing travel restrictions will rely on vaccine uptake, as well as our ongoing risk assessment on the activity of variants in the rest of Canada as well. For now, we still advise that whether vaccinated or not, travel should be for essential reasons until we understand where the variants will take us over the next few weeks. Travel for Canadians will get better soon, but we as Canadians need to get past this third wave and get collectively to a highly vaccinated state. In this interim period, while we await spring and summer, every person vaccinated makes a difference. As of yesterday, over 65% of Yukoners have received their first dose of vaccine. We will release numbers by age group once they're confirmed, but I can tell you that there are definite differences between older and younger Yukoners. As we drop from the 70-plus age category, the percent vaccinated drops with every decade. Believe me, every additional Yukon resident vaccinated makes a difference. Vaccine uptake is our key to freedom and our key to protecting us against variants. I'm pleased that the vaccine is shown to still be effective against B.1.1.7, but that may not be true for other variants. The faster we can get to be protected globally with vaccine, the less opportunity there will be for new variants to emerge, particularly those more resistant to vaccine. Whether for your own protection or to help protect all of us from COVID, please don't wait any longer. Get your vaccine, whether here in Whitehorse or in your home community when the vaccine teams return for the third round. In Whitehorse, the Mass Clinic is still accepting walk-ins, so no appointments are necessary. Vaccine and continued adherence to the Safe 6+1 will see us through to the better days ahead of us. So it's now up to us. Even though we don't know for sure the magic number of how many we need vaccinated to be fully protected, we do know that the more people that get vaccinated, the faster and safer we can get through the rest of this pandemic and protect ourselves against a wave or influx of variants. Many areas are now appearing to go through a third wave. We here have had outbreaks and clusters, but we haven't yet had a true wave of community spread. I mentioned at the beginning that this is a month of anniversaries. Looking a year back, we definitely have new challenges now, but we also know this virus much better. We have a year of experience managing this. We also have so many more tools and much more sophisticated tools. We can test people. We know that quarantine works to keep people from spreading the virus, even if they haven't. We know the effectiveness of public health measures, and we know that masks can also help. We know how to prevent transmission of COVID in various settings, variant or not. And now we have vaccine. And we are close, so close to getting over this. I'm not in a position at the moment to announce dates of lifting of restrictions, but this is the time to get ready by getting vaccinated. We will get there, and we'll get there soon. That's it for today. Thank you. Merci, Masicho.
Thank you, Dr. Hanley. We'll now go to the phone lines, and we'll begin with Nick, Canadian Press.
Hi, thanks for taking my question. I'm just curious. I believe you had talked earlier about hoping to achieve herd immunity during an announcement back in January and achieving that immunity in March. I'm curious if the territory is any closer to that, or if there's been any update on herd immunity itself.
Yeah, thanks for that question. And as we have mentioned herd immunity and mentioned it many times, as you mentioned, but the trouble is we don't really know what that number is. And if there is in fact one number, and an example of that is, what if you have certain segments of the population vaccinated more and others less? And so an example for that is, as I alluded to, our elders are very well vaccinated. We're still going ahead with some first doses in older people, but our rates are much higher in older people versus younger people. And so if we have a pool of susceptible younger people who are working age, who are have parents and families, there may be risks for transmission even while we have a high overall rate of vaccination. And so that influences our susceptibility. So the other thing that affects herd immunity is, what is the R0? In other words, what is the transmissibility of the virus? And that will depend on the presence of variants or not. So there are lots of kind of things in the mix, including we have, although we've set our goal at 75% as a first goal, that was, which we think probably roughly corresponds to herd immunity. We don't have a definitive figure, and we may never have a definitive figure of what that number really is. But so that's why I think still like a 75% uniform goal across all segments and all areas of Yukon, I think would be a really good number. And I think that would put us in a very strong position, whether or not that is herd immunity. But the more, again, the more we can get, the more confident we can be that, if we can go beyond that number as high as we can, will give us that comfort and confidence to have something that approaches community immunity.
Thank you. Do you have another question, Nick?
Yeah, one more, if possible. Just on your comments on encouraging people to get a vaccination. Have health officials encountered any hesitancy or any objection to getting the vaccine?
Yeah, for sure. I mean, there are a number of reasons, and we're working with people. We're working with various communities and whether individuals or groups to both to try to understand the reasons and also to be able to give people the information that they may need to make that decision. That they then have that comfort and confidence to go ahead. So hesitancy can be for a number of reasons. And it can be, there's been situations, for instance, when people have medical conditions and they're concerned about whether they might be more at risk because of a medical condition. And usually that just requires just some explanation of, the vaccine and the nature of the vaccine, and that it is perfectly safe unless there is a serious allergic reaction, a known reaction to one of the constituents. And but some people just need that time, need that conversation. We have others. We've had situations where people who may be more hesitant because they are pregnant or planning pregnancy or breastfeeding. And again, I think being able to give the reassuring knowledge that we have on vaccines in general, on the nature of this vaccine, and again, being able to give that confidence to go ahead. So there are these individual reasons. There are people who are concerned about the time that it took to reach this vaccine, and again, as a matter of just giving that information that yes, this vaccine took a shorter time than it has historically taken for many or most of our vaccines, but for very good reasons. We had many people working on this with huge funding around the globe allocated to this intense research, rapid clinical trial. So all of the right measures were done. They were just done in a more accelerated fashion than normal, but no step was missed in the regulatory approach. And people might need to hear that, read it, hear it multiple times until they are convinced. We realize that people are on different timelines of acceptance and understanding, but I hope that with continuing to provide that information, continuing to gather the global experience that we have with these vaccines and the remarkable safety record, then we can continue to chip away at the remaining people who are still holding back.
Thank you. We'll move now to Luke, CKRW.
Hi, Dr. Hanley. The first question I have for you is I'm wondering if the territory has received its full allotment of vaccine doses from Moderna.
Yeah, I think there's still two more shipments. Okay, so we have, and I can probably get you those numbers because I don't have them in my head, Luke. But we have been getting our numbers on time. We did, of course, get that large allotment, a couple of weeks ago now, I think, which was the 16,000. And so I think we have two smaller allotments to get to our level. We have, as I think so far, the assurance that the next allotments will come on time. The first, I'm just told by Pat, the two shipments for quarter two. The first quarter shipments are now complete, and we have two more shipments in our allocation for second quarter. So that will allow us to continue with second dosing on schedule and still have enough for those wanting first dose.
Do you have another question, Luke?
Yes, I'm wondering if the slow sort of distribution of vaccines around the rest of the country, combined with this recent third wave in a lot of the more densely populated areas, is maybe discouraging you and maybe causing you to rethink a lot of the tentative dates that maybe your team has about reopening or loosening restrictions.
Yeah. Actually, I would say no, not at all. Where, in fact, I think with the recent accelerations in vaccine uptake in Canada, I find that information really reassuring, and I'm very optimistic that that those Canadian goals of by late summer into September, getting up to a high uptake of vaccine, it's looking pretty good, and as the supplies are being now more and more confirmed for the Pfizer vaccine and for Moderna and for the other products as well. So I actually think things are looking pretty good. I think just again, we have to recognize that I won't be speaking to specific timelines during a period when we're in an election, because these are government decisions that are based on my recommendations. But our team continues to work on this analysis. I mean, even if you read Dr. Tam's statement from her last press conference, this is a time when we're all, not only in Canada but internationally, figuring out the right way forward in this kind of current struggle between variants and vaccines. So there is there is still some analysis and figuring out and some planning to do. And we are in this, we will be, at high vaccine uptake before the rest of Canada. So there is this kind of period where we will be in a very strong position, but much of what we do has always relied on importation risk, and therefore our calculations will always factor in that risk of importation of cases based on the Canadian situation, and of course based on the vaccine uptake in the provinces and in the activity of the variants.
Thank you. We'll move now to Mario, Radio-Canada.
Hi, good day, everybody. You mentioned, Dr. Hanley, that we are in the middle of elections. Loosening restrictions is a government decision. So let me just ask you, what impact are the elections having on the work that you do and your relationship with the government does for now?
Yeah, I can probably give a bit of an overview. I mean, this is so-called caretaker government. So if critical decisions need to be made, they will be made. But it's also a decision where it's also a time when non-critical decisions are deferred, and the sort of the normal everyday business is being carried on through the caretaker government process. So there are clear guidelines for this. It actually, in terms of the work that we are doing, it has actually very little impact. It's not as if it puts us into a delay. As I said, we see that we are in this in-between interim period anyway, regardless of political circumstances. And if anything, I think it gives us a bit of breathing room as we watch the variant activity, as we watch how large these third waves are going to be in the provinces, and benefit from the rapidly accruing evidence around vaccines, what the vaccines will be able to do for us, the vaccines versus the variants, the role of the vaccines in preventing asymptomatic transmission. So all of that kind of accumulating evidence factors into our analysis and planning, and I think will be able to help us robustly advise the next government.
Do you have another question, Mario?
Yes, sorry, I'm trying to unmute. I missed a bit of this when you were talking in your main, what you were saying earlier, just about the drop of vaccination when we look at the younger ages. I was wondering if you might be able to just talk a bit more about this, and I'm sorry, I actually missed that second.
Yeah, no, that's fine, and I'll be able to talk more specifically in future updates when we have confirmed numbers. But what we are seeing are trends where we have higher vaccine uptake with older age groups, and I think that's not an uncommon phenomenon looking at other areas, but we tend to have more. I think, a little more hesitancy among the younger groups than the older groups. Now that can relate to many factors. For one thing, the younger people didn't have as much a chance to go as early as the older people. So the older people have had more time to come forward. So we're still, we're still in this upward slope. The second thing is that older people tend to have more individual reason. They know that they are at higher risk for more serious outcomes, and therefore I think there's more. The older people will see themselves appropriately as at higher risk from COVID, and then therefore are going to be more motivated to come forward more easily. Younger people are busy working. They're working. They have families. They have many other things to do. So I know that definitely factors into vaccine uptake. They also may be just waiting, looking for more information, and holding back for numerous reasons. At the same time, I mean, we still are overall in a remarkable period, over 65% overall. We're seeing the numbers increase. I'm optimistic that will continue to be the case, but we need to keep working with our younger groups and making sure, again, that they have the information and the comfort level to come forward for vaccine.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, good morning. Dr. Hanley, I had emailed a couple of questions to your office late last week regarding to some new information coming out that people who have been infected or exposed to COVID are having much stronger, more intense reactions to even the first Moderna shot. So sort of a two-part question. One, should people be advised about that? And two, is there any way to use that kind of information to track the actual extent of COVID, which could be anywhere from 4 to 10 times higher than the official records indicate?
Yeah, it's a good point, and I think it speaks to it's almost like we have seen the second dose effect, Tim, where we know that side effects associated with the second dose are more prominent than with the first dose, and I think it simply speaks to the same phenomenon of a booster effect, where someone who has been primed with actual COVID infection then gets the vaccine. It really is like a second dose, so they may well feel those effects more strongly. I mean, we see so much variation. As I'm sure you have heard, we've had people who feel absolutely nothing, and in fact, I've had people who are worried that they may not be responding to the vaccine because they felt nothing the next day. And we see people, even with first dose, who have felt significantly unwell, even enough to miss work the following day because of aches or fatigue or fever, and we see that more commonly with the second dose. However, with the majority of people, the effects are minor for either dose. So it's not. I guess what I'm saying is it's not reliable enough to be able to determine whether one, judging by the degree of side effects, whether that could be correlated with a previous infection. It would be highly, highly doubtful and very, very unreliable. So there would be no way. And I know that there definitely have been those estimates in other areas. I would say that those are largely areas where there has been community spread. I do not think that we've had significantly more COVID activity in Yukon than what we have recorded, just because we have gone through periods of high testing. We've tested many people. We have had hospitalizations only associated with people who are otherwise parts of known outbreaks. We've seen no surprise signals. So we have many. I would say we have many signals that do not indicate that we've had significant undetected COVID cases. Now, I suspect. Just to complete that, I suspect that we have had individuals who have, just statistically, I'm sure we've had individuals who have come in from other areas, possibly carried COVID, stayed in self-isolation, gotten over it, and never came forward for testing. So undoubtedly we've had some of those, but none of those have led to spread or outbreaks because, again, by and large, people have done the right thing with self-isolation, and that's been our whole reason for having these quarantine requirements.
Thank you. Do you have another question, Tim?
I do not at the moment. Thank you.
Thank you. We'll move to Chris, CBC.
Good morning. Thank you. Just wondering, Dr. Hanley, if you could talk about, do we have a hard date or a firm date yet for the return of full-time high school classes? And then the second part of that, I guess, is how much does concern about the variants play into the exact timing of resuming full-time classes?
Thanks, Chris. I intend to have more to bring to you next week on more specifics around that. I know the work is ongoing between the department and between councils and the Yukon Teachers Association, and sort of those conversations are taking place. No, I'm not. I mean, when the decision was made and the recommendations, we already knew where the variants were going. I don't think there's been. I mean, the variants haven't surprised me at all. I think they're doing exactly what they're predicted to do. So that has not certainly influenced my feelings or recommendation. I think it's just more of a matter of working out the logistics and making sure that everyone is on side for this to happen.
Thank you. Next question, Chris.
Yeah, I guess the second question is the most recent update on the website is that we've got 65% of adults with their first shot, 31% with their second shot. I guess, is there a point at which, you have sort of addressed vaccine hesitancy in fairly gentle terms in trying to encourage people to get the shot, but is there a point at which you maybe stop playing nice if the vaccination, particularly the second shot rate, doesn't come up to something closer to 75%?
Well, I guess there's nice and there's nice. I mean, it depends really what you're alluding to. If you're alluding to a mandatory policy, no. If it's more a matter of trying to understand the reasons and addressing those reasons, yes. I think more to come there, and we're continuing to do a lot of work again. Individual conversations, community conversations, communities of people, just trying to address those concerns, and again, it's never going to be an overnight phenomenon. We always kind of expected that you get a large rush and then you get a tailing off, and I think this is what's happening, and I think that we still have time to address that kind of remaining 10 to 15% to get us to that good level. But again, I think it's not so much. The global number is important, but the uniformity of that number is also important. I think if we don't play nice, as it were, then we can also alienate people and force people to think that they are being unfairly coerced, and that can have a lot of negative consequences. So, in other words, it doesn't necessarily work. What works better is really digging into and understanding the reasons, and as I say, working with people to be able to give them the right information to make the right decisions, and then we'll see where we get to. But I am optimistic that we can continue to make progress and start to get near those target numbers.
Thank you. We'll move to Haley, Yukon News.
Thank you. I've been reading about conversations happening at the federal level about vaccine passports, and I wondered, Dr. Hanley, have you been a part of that conversation at all, representing the Yukon?
My involvement is mostly in the conversations with the Public Health Agency and the other chiefs. Certainly, there is work. There's a lot of work being done on that possibility and the rationale and the pros and cons for it. So I think it's it's an obvious question around the world of should there be a vaccine passport? What would it look like? And what would be the benefits, and what are the risks, and what are the downsides? I think my focus again is continuing to work away on on getting our whole community to a level of uptake where we can have that freedom as a community, rather than it depending on an individual's vaccine status. That we have enough community protection to be able to open up widely, both as a territory and as a country.
Next question, Haley.
Thank you. No, just the one question for me.
Okay, thank you. We'll move to Laurent Boreal.
I don't have a question, thanks.
Thank you very much. I'd like to thank everyone for their time today and advise that the next COVID-19 update will be March 31st at 10:30 a.m. Next week's technical topic will be based on testing for COVID-19 and Yukon's rapid testing strategy. Again, if you have questions, please email hss@yukon.ca or post a question to the HSS Facebook page.